afternoon, everyone. Very excited to be here. Justin and I both are, to talk about a topic that I'm very passionate about, the benefits of a psychologically healthy workplace. So as Tom stated, my name is David Pawlowski. I'm Vice President of Administration at CuraLinc Healthcare. Basically, that means that I wear a lot of hats. I am a licensed clinical professional counselor. I'm also a certified employee assistance professional. And with me today is Justin Steinecker, our Vice President of Sales. If you're not familiar with CuraLinc, we are a national EAP provider based out of Chicago. We've got about 800 clients across the country, from Alaska to Puerto Rico and everywhere in between, and about 700,000 covered employee lives. Got to meet a few of our clients here in person over the last couple of days, so that's really been nice for us to put some faces to names and folks that we work with. So I want to talk a little bit about kind of what our goals are here today. What Justin and I are here to do with you today is really to talk about a topic that's, I think, really starting to grab and garner a lot more attention from employers all across the U.S., and that's the benefits of a psychologically healthy workplace. As an organization whose focus has always been on helping employers keep their employees happy and healthy and productive, we couldn't be more thrilled that more and more employers today are open to taking a closer look at least, at the emotional health of their employees. And thinking about how the workplace can have a positive or a negative effect on an employee's psychological health and well-being. Because we believe that an EAP that's positioned the right way, that's built the right way, is really one of the most powerful tools available to help employers build and maintain a psychologically healthy workplace. It creates a culture where employees aren't just surviving, they're just not getting through the day, but they're actually able to thrive. So we've got a few, walk-away goals for maybe our next 25 minutes or so together. First, we'll tackle the question of, why should employers care about the mental health of their employees in the first place? Now, for some of us in the clinical field, like myself, this might seem like a silly question. To me, of course, mental health is a big deal. And of course, an employee's mental health, can have a direct impact on the workplace. But I want to tell you something. When I first got started in EAP about 15 years ago, I will tell you that the last thing that most employers really wanted to talk about was the mental health of their employees. Whether it was a lack of awareness, whether it was stigma, whether it was denial, just most employers that wasn't a place that they were really ready to go. Now, that doesn't mean that there wasn't a need for EAP services. There certainly was. But the call for help would typically come after some sort of, unfortunate or tragic event, maybe an employee suicide, an overdose, workplace violence, a significant problem impacting an executive or other high-level employee. Now, fortunately, more and more employers today that are realizing that there's little things that they can do today that prevent bigger problems from happening later on down the line, and that it's also good for their bottom line. So today we're going to tell you exactly what some of those things are, what the American Psychological Association refers to as a psychologically healthy workplace. And we'll also be telling you about the benefits of a psychologically healthy workplace, both for employees as well as for employers. And then after that, I'll turn it over to Justin, who's going to explain how an EAP, an employee assistance program, which, by the way, is the one benefit out there that's specifically designed to address behavioral health, how it's the best tool available to help employers build and maintain a psychologically healthy workplace. And since not all EAPs are built the same, there's differences. We're going to talk about some of the key components to look for in an EAP that will help lead to the types of positive results that we're going to talk to you about today. And speaking of results, we're also really excited to share some of our most recent data, some of our 2016 data regarding outcomes. So obviously ROI, and that's a big, important thing in terms of cost containment, but also clinical and workplace outcomes, things like reductions in symptoms of depression, reductions in problem drinking, workplace outcomes like reductions in absenteeism and better productivity. And I guess before we dive right in, I thought maybe we could try to have a little bit of fun. I'm a clinician, so probably people think I'm not that fun, but this is the live entertainment capital of the world. One of the ways that CuraLinc supports organizations who tell us, this is something we want to do, this is a goal, we want to build a psychologically healthy workplace, we do a lot of training, okay? Knowledge is powerful stuff. We're all here learning a lot. I've learned a ton in the last couple of days. So we do training both for employees as well as for management on basic mental health awareness. What are some of the things to look for in an employee who might be struggling with an emotional health issue? And what can I do about it, if I realize that's happening? So our trainings help employees and coworkers and supervisors identify those signs, connect with the person, and then guide them towards resources that are available to help. It's not complicated, it's pretty basic stuff, but you would be surprised how kind of foreign this concept is to a lot of folks, just because of some of the stigma, I think, surrounding the topic, as Tom alluded to earlier. So we like to start with a little bit of an icebreaker, and I thought maybe we could give it a go here, and we'll see how this goes. So it's pretty simple. There's a few words listed up on the slides here, and I'm going to read each word, and then I'm just going to ask all of you to just repeat them out loud, okay? Pretty simple. So, ready? Okay. Mental health. Mental illness. Psychological. Depression. Anxiety. Okay, that's the hardest thing I'm going to ask anybody to do in the whole presentation. You can all take a deep breath. Okay. Now, I want somebody to tell me, as you say those words, what are the first reactions that you have when you say a word like mental illness or depression? What's the first thought or the first feeling that you have? Can anyone brave share? That's got to be you. Okay, so you start turning inward and thinking about, well, this is me, right? They must be thinking about me. Another common reaction is for folks to say nothing at all. And thanks for sharing, I appreciate that. To say nothing at all, to kind of shut down, to shut off, okay? They don't want to go there quite yet. Andy Core, in his really excellent presentation yesterday, talked about sort of the disproportionate salience of our initial thought or our initial reaction on our behavior, and I believe that's absolutely true. If our initial reaction to something like depression or anxiety or mental health is to kind of shut off and shut down, then there's a much greater likelihood that we're going to kind of ignore those little signs and things, and they can really easily spill into something bigger later on. I'll explain it a different way, maybe, to help kind of illustrate this. So I'm a marathon runner. I'll be running my 16th marathon this fall in Chicago, and I deal with my share of injuries over time. I'm 40 years old now, so they come a little bit more frequently. The weather out here is beautiful. I've been enjoying the weather and getting out on runs. But what if I go back to the office tomorrow and I've got, a walking boot on my leg or a cast, or I'm on crutches? How do you think my coworkers and colleagues might react? Well, if I know my colleagues and coworkers, they're going to be really caring and compassionate. They're going to reach out to me. They're going to know, hey, that's going to be really hard for Dave. This is a big thing for him. And, they're probably going to try to cheer me up. They're going to make sure that hey, if you talk to your doctor, they're going to be giving me advice about, things that they might recommend or suggest. I'm going to feel pretty good getting that kind of support. But if I were to go into the workplace, and maybe not my workplace, because I'm surrounded by a lot of mental health professionals, so it's not the typical workplace. But if I were to go into another workplace and maybe, I'm feeling depressed, I'm looking a little down, or I'm quieter, I'm not the same outgoing person. My productivity or my performance is slipping a little bit. I just seem a little down. The natural reaction from folks in the workplace in that kind of situation is to kind of just back off. Oh, okay, I don't want to go there, don't want to talk about that, and chances are these types of issues, they don't typically get better on their own, unfortunately, just like physical health concerns. So that's what we're up against here. That's the stigma that we are kind of facing. So thanks for participating in that little icebreaker there. It probably goes without saying that, we think mental health and behavioral health is a pretty big deal. But you don't have to take mine and Justin's word for that. The data available today really demonstrates more definitively than ever that mental health issues and problems are costly, both in terms of direct costs like mental health and substance abuse claims, but also indirect costs, things that are a little bit more difficult to measure, like absenteeism and productivity issues and employee turnover. I was talking with an employer, a couple of folks from an employer earlier today at lunch, and they talked about the challenge of turnover in a call center environment. Very, very stressful environment. People don't call a call center when things are going well. And it can be very stressful, and a lot of time and energy goes into training those call center agents. And think of the cost when someone is dealing with a mental health issue or stress, and they leave work or their productivity or performance suffers. It's costly. It's hard to put an exact dollar on it, but it definitely is costly. Think about your own mental health and substance abuse claims. We know, and since those of you who have self-funded plans, you all probably know too, the average cost of an outpatient mental health counseling case, it's about $620. Now, I know that number does not sound very big compared to some of the other numbers that we've been talking about here when we're talking about, cancer and transplants and all of those types of things. But keep that number, $622, in mind as we're talking about the prevalence of mental health and substance abuse issues in the U.S. workforce today. Because there's a benefit that many of you already have, most of you may already have, that could address and resolve the majority of those cases without ever touching the benefit plan. So it does add up. And I don't want to get into too much of that because I don't want to steal Justin's thunder from later on. But keep that in mind. And even for the cases that maybe aren't resolved in the EAP. We partner, Cypress is a partner of ours, and we partner with a lot of groups that position the EAP as really the entry point into the mental health and substance abuse benefits. So not only are we to address and resolve many of those issues before they hit the benefit plan, for cases that do go into the benefit plan, they're speaking with a licensed clinical master's or doctorate level clinician who's providing guidance and advocacy and steerage to make sure that they get to the appropriate treatment, the lowest level of in-network care that's most appropriate to address their issues. So, there's definitely a cost savings there as well. But of all of these statistics, there's one that as a clinician, really stands out the most to me. Based on years of research conducted by the National Institute of Mental Health, 1 in 4 Americans, 1 in 4 meets the criteria for a diagnosable mental health disorder every single year. 1 in 4. So that means that I probably, given my gambling prowess and skills, I probably have a better chance of going home with a mental illness than I do coming back home on top from the blackjack tables. So 1 in 4. It's not a small number, and that's not all. For those who do develop a mental illness, less than half every year, 40%, get any treatment at all for that condition until it becomes a bigger problem. So whether it's a lack of awareness, whether it's stigma, whether it's real or perceived barriers to treatment, that statistic alone tells me that there's still a lot of room for improvement here. There's still a lot more that we can do. Those statistics that I just mentioned, they don't even take into account the biggest issue that employees face in the U.S. workforce today, and that's stress. According to research, a report by Willis Towers Watson, who I believe is here today, I haven't had a chance to speak with them yet, but 3/4 of U.S. employers ranked stress as their #1 health and productivity concern last year. It costs $300 billion a year to corporations and business in terms of productivity and turnover and legal and medical costs. So, let's face it, stress is an unavoidable part of life, and it's an unavoidable part of work. You can't eliminate it, and even if you could, you probably wouldn't want to, because a little bit of stress actually is good for performance. It energizes us, it motivates us, it keeps us in the zone. Most people are pretty resilient and can handle a relatively high level of stress for a short period of time. But the effects of stress, as we all know, are cumulative. And sometimes stressors are so severe or so maybe pervasive or prolonged that they actually overwhelm our ability to cope. Without the proper support, some people we know will turn to unhealthy ways of coping with that, all of which can lead to a whole variety, either cause or exacerbate a whole variety of physical or mental health concerns that impact our functioning, which you can kind of see on the slide here. Now, fortunately, improving stress management skills, taking advantages of other practical tools and resources, such as those that are readily available through an EAP, can get folks on track again pretty quickly, and we do it every day. They keep stress at a more manageable level. But in order for that to happen, in order for us to be able to do that work, people have to know that this benefit exists. People have to be aware that this service is available. They need to know that it's confidential. And that's really what creating a psychologically healthy workplace is all about. So faced with all of this data, okay, everything that we've talked about, not to mention the increasing healthcare costs, not for Cypress clients, of course, because Cypress is doing a great job of helping you keep those down. Because of competition and economic uncertainty, employers are more concerned than ever about attracting and retaining high-quality employees and helping keep up morale and employee engagement, minimizing workplace stress, and providing resources to employees to help them deal with these types of issues. They're trying to protect their most valuable asset, which is their employees. And they're taking a look at some of their own policies and procedures. They're taking a hard look at some of these policies, procedures to see, are these really in line with our own long-term goals and strategies for success? They're looking at the resources available to their employees to help them deal with things like depression, anxiety, stress, alcohol, and substance use issues. And they're creating workplaces that do more than just improve productivity. They actually build a vibrant culture that supports the company itself. And that's in short what a psychologically healthy workplace is. Now, you can break these down into a number of different categories or components. The first is employee engagement. Andy talked about this a lot in his presentation yesterday. Things like involving employees in decision making, giving them increased autonomy, creating or supporting employee committees or task forces. These types of things increase job satisfaction, morale, and commitment to the organization. The second component, and this is a big one, is work-life balance. Just acknowledging that employees have, responsibilities outside of work, that we all have responsibilities outside of work, and helping them better manage these demands. And EAP can be a tremendous resource for employees who need assistance with work-life balance issues, things like child care, elder care, legal or financial issues. But an EAP can also provide consultation to the organization on their own internal policies that might help support or improve work-life balance at their organization. An EAP that's built the right way can really be a tool and a resource for the organization as well. The next component that I just want to mention is employee growth and development, kind of like we're all doing here today. So whether it's personal or professional development training, coaching or mentoring programs, these lead to opportunities for advancement and really opportunities for employees to develop and learn new skills, even things like learning to more effectively manage stress. And as Justin's going to explain shortly, EAPs can provide training on a lot of these types of issues and topics, everything from team building and coaching to building resilience and mindfulness. Fourth component I want to mention is health and safety. I think employers today are realizing more than ever that the mental health of their employees is at least as important as their physical health. If you think of sort of our psychological needs as human beings sort of on a pyramid, then at the very bottom is our health and safety. And probably above that, our need for connectedness and being connected to other human beings. If we don't have that, we never really reach our full potential, either in our personal or our work lives. So health and safety initiatives, they maximize the physical and mental health of employees through the prevention and then the assessment, treatment of potential health risks and problems by encouraging and supporting healthy lifestyle and behavior choices. And remember, the only benefit really specifically designed to address mental health and behavioral health issues is your employee assistance program. I think it is important to note that there really is not any one-size-fits-all approach to this. Part of the success here is based on finding out what policies and procedures need to be addressed within your organization, and then tailoring programs and policies to meet those needs. And again, an EAP can be a great resource to the organization to provide consultation to do that. We have a lot of expertise in that area. So what are the benefits? What can you expect if you invest the time and energy? So if you do, obviously, I think employees are going to benefit from a workplace that's designed to support their mental health needs. According to the APA, who's an expert on this issue, employees in psychologically healthy workplace all across the country report higher job satisfaction, stronger morale. They have better physical and emotional health, and they report an improved ability to manage stress. But that's really, only one side of the coin. There's also just as many benefits to the employer, to the organization. So everything from improved performance and productivity, reduced absenteeism and turnover. Employers who create and then maintain a psychologically healthy workplace see a strong return on that investment. They attract and retain more quality employees. They report improved customer service and satisfaction, and they lower their overall healthcare costs, especially with respect to those mental health and substance use claims that we spoke about earlier. So in about 15 minutes or so, in a nutshell, I guess that would be what I would say about the importance of building a psychologically healthy workplace. And now we know that not every employer out there is all the way there yet. And just like our clients, we meet our employer clients and organizations where they're at. But we do see that more and more organizations are recognizing that the mental health of their employees is just as important as their physical health. And as they used to say in one of my favorite cartoons growing up, knowing is half the battle, right? Unfortunately, the other half of the battle is not a battle that you have to wage on your own. Because if you're working with an EAP partner that has a program that's built and constructed the way that Justin is going to tell you about, you will have a partner to help you build and design and maintain a workplace that is conducive to the mental health of your employees and is also good for your organization's bottom line as well. So I'll turn it over to Justin to talk about those components.
Thank you, Dave. When talking about stress and anxiety, he left me 5 minutes to do 40 slides. I'm kidding. I've got maybe 6. What I want to talk about has a lot to do with best practice design, things that we really have focused on in building our platform, but we think would resonate with the folks in your areas as well. Quick show of hands for those on the employer side. How many groups utilize EAP, but predominantly through their embedded life and disability programs? Or at least think it's there through their life and disability. A couple hands went up. How many have actually carved it out and are using it in either a specialty format or in some other capacity? Okay, a couple others. Okay, so what I'm going to speak to has a little bit to do with what we look at from a blueprint perspective, how we envision best practice around EAP, how it's designed, and what types of services are being brought to the table. But to echo some of the things that Andy had talked about yesterday in relation to wellness and the conversation around total well-being, there's a lot more there outside of the physical side of the equation in the total well-being conversation. So we're really trying to bring more aspect of the mental health side as well as the financial and emotional side of the fence. So when looking at a proper construct with an EAP provider, this is something you're not typically going to find within the embedded life and disability programs. They're there really as a safety net. They're there as a reactionary sort of environment that there's a workplace incident, there's an employee who walks in and says, I'm kind of losing my mind, can you provide some sort of resource for me? Or their first inclination is to go right to the health plan and seek services there. When properly constructed, properly communicated and positioned, these type of services can really be a huge advantage to both you as the employer as well as the employees that are part of the overall program. What we focus our platform on, and I don't want this to be a sales pitch specifically around CuraLinc, but more so a best practice around what you as employer groups and you as brokers and consultants should be looking for is, what does this process even look like? What is going to happen when an employee actually chooses to hopefully jump the stigma threshold and utilize the EAP program for whatever their needs are, be it short-term counseling, be it work-life or financial type of services. So we really want to provide the first level of access. Will there be somebody there to answer that call 24/7, 365 days? Again, in some different models, that may not be the case. What is the quality of the person taking that call? In our particular model, these are master's or PhD level clinicians, independently licensed, so they could be out doing their own thing, but they happen to work for CuraLinc and taking these inbound calls with our members. They've got anywhere from 13 to 15 years on average experience that really helps from a quality perspective with the intake. And what the responsibility then is focusing on guidance, focusing on advocacy, focusing on steerage, so that we're providing the right assessment and understanding what that person's root cause is. What it was the key factor that put them in a position to call into the EAP. How can we stay with them from an advocacy perspective? How can we continue to be a guide as they go through this process to make sure they're getting what they need from a service perspective? And then from a steerage level, where is the proper utilization? What can we do from reducing the potential of failed referrals? That is a big issue within the EAP space, where people, again, have finally taken the ownership to call in and utilize the service, but what they don't receive on the back end causes them to not continue through with it. So there are numbers as high as probably 65% in the EAP space where people have reached out but simply haven't followed through. So what can we do from a steerage perspective that help people stay engaged and hopefully utilize the right resources as they navigate the program? We look at a three-pronged approach in the way that we want to engage with them, utilizing multiple modalities. Finding out from the employer group, how do you communicate other benefits? How do you communicate around the health plan? How do you communicate around disability, the wellness issue? How do you get that out into the hands of your employees so they're aware of what's available to them, and in turn getting them to engage and actively participate in them? We like to meet members where they're at, or we recommend a meeting where members are at. The millennial population, they want something probably coming off their phone. That's where they're going to turn 9 times out of 10 to gather information. So where can technology build into those platforms as well, so that they've got access to that information when they feel it's time for them to take that first step? And lastly, looking at the marketing integration with other providers. Integration is huge. Integration is key. EAP, I think, historically has been somewhat of that redheaded stepchild. My apologies if anybody in here is a redheaded stepchild. But they've sat on the periphery. They've been embedded. They've been tied in with the life and disability. There hasn't been a conversation taking place. I know, they're all making fun of her right now. You weren't adopted or, okay. But we're really, again, trying to promote more around, even from the day of implementation, how can we better align with the health plan? How can we better align with the wellness initiative, the disability, the pharma benefits, dental? Who would have thought dental has some sort of integration that could potentially work with TMJ when people are suffering from stress and anxiety? How can we look from a claims perspective where people might be a good candidate for an outreach with the EAP? Okay. On the topic of innovation, bringing, again, different modalities and opportunities to engage with populations. We have a number of different programs, what we call eConnect, which is something that we've branded, we've copyrighted, but it's an opportunity to connect with people, via teleconference or via phone applications, because not everybody wants to go and sit with a counselor and have 5 potential sessions face-to-face. We've got our computerized cognitive behavioral therapy program, CCBT. This is something that came to market 10 years ago that wasn't really all that well adapted, but now 10 years removed, it's seeing this resurgence back into the marketplace to, again, help meet people where they're at. We did a soft launch of the program, if you will, back in January with a select group of employers that covered about 40,000 total lives. And what we saw within the first month that we rolled this out, that 93% of the people that were utilizing the CCB tool had never once communicated or reached out to EAP. So we're recognizing new opportunities to, again, engage and bring different tools and resources to the table for people to meet them where they're at. Again, I say we, but it's somewhat of where the marketplace is going. Client services support, you, again, don't really get that in the embedded models. You may get it to a certain degree within the health plan design. We're really trying to show more of a single advocate from an engagement perspective, making sure that they understand what are the strategic needs of the client, working with them throughout from a data perspective, and then the capacity and willingness to integrate. Where, again, can we pull all that information together, and I'll be speaking from a single source. Dave spoke real briefly to the management consultation side, the training initiatives, critical incident. These are, again, areas where you can really provide a lot more value and substance in getting supervisors and managers on with the overall development and cultural and experience that the employer is trying to develop and execute for their population. Areas that we just recently were talking to one of our employer groups here around. We did something last year that was maybe more substance abuse in focus. This year they want to consider more of a harassment initiative that they want to implement and train their employees on. So those are things that we're going to look at. Sometimes they're very out of the kind of out of the box. We can kind of plug and play, but maybe we look at customization because of specific issues that organization has been experiencing, and really being able to engage with their upper level management on a one-on-one basis. Spoke really briefly to some of what we do on the clinical intake side of things, but because of what we do in the intake as well as from an advocacy perspective and outreaching and following up with our members who go through the programs, we're able to track data like this. We're able to report data back that shows there's legitimate true outcomes from a clinical perspective, and what we're able to do in areas of depression, productivity, absenteeism from the workplace, and alcohol use and substance abuse. And finally, the financial dashboard. One of the biggest areas I think that we really attach to, and Dave spoke to it, that's $622. How can we, again, provide steerage and advocacy to help people understand when is the health plan the right solution, or the right area for them to be reaching out to for services, versus where can that EAP provide a lot more substance for where that person is at. When we take what we do from an outcomes perspective, and really, we're not that expensive of a program, you can kind of tie it back into about a 4.9 to 1 ROI. Okay? I'm going to flip, is that my last slide? That's my last slide. So I'm going to flip it back over to Dave, and he's got one or two things just to finish out.
I'll just end real quickly. Obviously, return on investment and outcomes is critically important to us, but at the end of the day, it's also about your employees and their family members, helping people realize that mental illness is real, it's common, and it's treatable. Treatment works, it's available, and try to do everything that we can to sort of reduce that stigma. So we appreciate your time, and if you have other questions, we're happy to answer them today or tonight or anytime. Give us a call or shoot us an email. Our contact information's up here. Thank you.